Welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare we provide to you at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units. The Regional Best Medic Competition challenges the Army's best medical personnel in a demanding and realistic simulated operational environment. The competition tests the mental and physical stamina as well as the tactical and technical skills of the competitors.
Womack Army Medical Center hosted this year's Regional Health Command Atlantic's Best Medic Competition at Fort Bragg, North Carolina. Competitors throughout the region came to put their skills to the test.
This competition really demonstrates readiness. It really demonstrates the readiness of the medics that are required to take care of those warfighters and those operational units, but also take care of those folks within the hospital. I think what they realized as soon as they got here that the competition was going to be a little tougher than they thought it was going to be.
This is a place where you pull the best of the best and then you compete to see where you stack up against these guys. So I just wanted a challenge.
This is readiness, and this is what the Army's made of. So I love doing this kind of stuff, and that's why I keep coming back for more.
The soldiers were challenged for 3 days with an obstacle course, land navigation, a ruck march, and a mock mass casualty event. An event this large doesn't happen overnight.
There was a lot of planning that had to take place prior to execution of the Best Medic competition for region. We've been planning for the last 5 months to help make this event successful. I'm actually looking forward to seeing just the soldiers in action, seeing their motivation, seeing the cadre, all of their hard work into action and the fruition of all of the planning.
It's about recognizing these 14 medics for really what they represent. They represent the best that the MedCom has to offer.
The Best Medic competition benefits both the Army and Army medicine.
This is beyond, and it simulates what they will meet in combat. You know, to provide the combat health support far forward on the battlefield like combat medics, this is it right here. They're pushing themselves beyond their physical, mental, emotional capability so that when they are in combat, they can meet any challenge that comes to them, as they still have to maintain their mind to treat any casualty that comes their way. So it's preparing them for readiness, medical readiness, anywhere, any world, anytime.
During Hurricane Irma, Winn Army Community Hospital remained committed to providing high-quality health care to their beneficiaries. Essential personnel stayed behind as the hurricane passed through Fort Stewart, Georgia. Zach Renstrom brings us their story.
We need to make sure all of our stay-behind personnel are prepared. We have 126 personnel in our organization that are stay-behind personnel. That means if we evacuated all of Fort Stewart, they're staying here to keep the hospital operational. We've taken the lessons learned from Hurricane Matthew last year and drilled and rehearsed for what would happen with this scenario, and had battle drills ready to go in case this demand was here.
We actually facilitated moving our psych patients out of the facility to our sister MTF over at Fort Benning. We actually coordinated with Beaufort Naval when it came to this particular hurricane. We were able to assist them with getting their patients transferred out to Fort Gordon.
And as we now transition into the storm, ensuring that we're prepared to provide inpatient and emergent services to our community as needed.
We're considered essential personnel. We have an inpatient function which is 24/7, and we as a team decided who would stay back and who could be let go and evacuate if they wanted to. And we decided that we would be able to support the mission 24/7 for laboring patients and for couplet care for mothers and babies and their families.
A lot of people left and they stayed. So I'm sure some people were scared, but they have a job to do and they took their job, they made it priority over what they were feeling. You wouldn't even be able to tell that there was a hurricane going on outside. Everyone was really calm, everybody was really nice and caring, and even though a lot of people were working longer than they're used to and not getting a day off, they came in and they didn't act like they were tired or irritated to be here. It makes me really grateful, because if this place wasn't up and running, I don't even know where I would have gone, and they should be really proud of themselves. And I think everybody else should be really proud of them too.
Well, these guys are all top-notch. The civilians, the contractors, the military, they truly care about their patients.
We've been working continuously, sleeping in the emergency department, and there are some strains there. It's difficult being apart from your family at a time like this, and there are certainly some sacrifices that the staff make, but we were able to provide probably even more emergency services than certainly we were able to during Matthew, because we've planned a lot since then.
We're now preparing to transition into recovery operations so that as we do any cleanup or recovery or take care of any injuries afterwards, our staff are ready to go, both not only here for the Fort Stewart area, but also to ensure our personnel are ready to deploy forward to other areas of Georgia or Florida as required.
And finally, we announce the winners of this year's Warrior Care and Transition Program Cadre Award for Excellence. The awards celebrate the achievements of the Warrior Transition Unit Cadre in support of wounded, ill, and injured soldiers and their families. The regional winners will compete at the Army Medical Command level in their respective categories. That's the Regional Health Report for October. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. We're also on the Army Medicine channel of the Defense TV app. Thanks for joining us.